And that might seem like a mouthful, but I think we all realize that our health really is imperative for us to lead these thriving, successful lives that everyone cherishes. And we need to work on how do we help more people in Orange County live healthy and move from just surviving to thriving. So again, thank you so much for joining us. We have an amazing program. We have a terrific speaker, really insightful panel, and we're so glad you're with us on this journey of how we help more people in Orange County achieve that self-sufficiency. If you were part of our first panel, or part of our first session, which was at the end of January, we learned about the real cost measure that is conducted by United Ways of California. And we learned some really startling facts and just things that we just need to realize as we move forward together of how we help families. If a family of 4 and 2 young children, it can cost up to $98,000 to live and thrive in Orange County. That's a lot, and we need to do more to help more people have the ability to be successful. All right, so social determinants of health. And I'm going to read some of this from the CDC. It's conditions and places where people live, work, and play that affect a wide range of aspects of our health and our overall quality of life. There are 5 main domains: economic stability, which is why this is all part of our United for Financial Security initiative. Economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, social and community context, and you're going to learn a lot more about these topics and the real impact it has and how we can help as a community. So I'm going to do the housekeeping. So this is going to be recorded, just so you all know. So we're happy to announce that. The chat has been disabled because I want you all to pay attention to what the amazing speakers are going to say. However, the Q&A is wide open. So please let us know your questions, and there'll be time at the end, and we'll get to as many of them as possible. So now it is with great pleasure that I'm going to introduce our first speaker, and that is Addie Namathy. And Addie is the Distinguished Professor and Founding Dean of the Sue and Bill Gross School of Nursing, the University of California, Irvine. She's going to share some insights with us on the social determinants of health, help us understand them more, and really focus on how this can impact children. And Addie is not only this distinguished professor, she is also a United Way board member. So thank you so much, Addie, and I'll let you take it away.
Thank you so much, Sue. It's such an honor to be here. I am going to share my screen and open up my slides. So let's see. Okay, can everybody see? All right, so it's such an honor again to be here, and I'm going to talk about social determinants of health, particularly as it relates to children. And as Sue just mentioned, these are the factors that are the social determinants of health, where we're born, grow up, work, and age. And what's so critical about this is that the social determinants of health are increasingly recognized as critical drivers of health and well-being. So that's the reason why we really need to pay attention to these. In terms of children, social determinants of health have a profound impact on their life chances. And that's why we want to ensure that we are able to give children the strongest path in terms of life. And if there's nothing else that you remember from the conversation today, I just want to share that poverty and inequity are deeply empowering. And when people perceive that they don't have equity and opportunities and live in poverty, they are not able to move forward in terms of making such critical life decisions and health behavior decisions. So next slide, please. So these are the actual determinants of health that impact health outcome. Housing, which United Way is doing such a phenomenal job. Insecurity in terms of food, ensuring that children get the education that they need, transportation, etc., exposure to violence. All of these things are critical. Next, please. What's so interesting about this slide is that, as you can see, the green portion at the very bottom, 20% of the impact of social determinants of health on health outcomes is related actually to accessing healthcare and quality of healthcare. In fact, 80% really deals with the physical environment, the social economic factors, and the health behaviors that individuals select. So that's why there's so much that we could do to change the impact that social determinants of health have on health impact. Next, please. I find that this slide is just so powerful because it looks at geography. And when you go for the darkest red to the darkest blue, there is an increase in life expectancy by 20 years, which is just incredible. And so really what this says is that your zip code oftentimes impacts your, is probably more important than your genetic code. So where you live is critical in terms of how it impacts health. Next slide, please. And this is also shown in this slide here, where you could see Chicago and Brooklyn in terms of homicides. And you can go from the white areas of less than 1 to the dark red burgundy colors to greater than 90 homicides per 100,000. Again, geography is so important, and community in terms of life expectancy. Next, please. And this is a slide that relates to women's health. You have 2 individual women, Mary and Nora. Both of them have some health issues, overweight a little bit, borderline hypertension, and just moderately active. Mary lives in a higher income area. You could see on the right, her 10-year health trend is improving, is going up, as opposed to Nora, who has exactly the same health status factors, but she lives in a lower income area, and you could see her health income is, or her health status is actually on the downward trend. Next, please. So when we talk about homelessness in terms of children, there are many, many children that are impacted by this. As you can see, 4.5% in 2017-18, over 278,000 children. While about half of them are kindergarten age, there are also quite a few that are in grades 6 to 8, as well as 9 to 12. In fact, the American Academy of Pediatrics is now recommending screening of children just based on poverty alone. And we'll talk about these, what are called ACEs, adverse childhood events, in a few minutes. Next, please. Just a little more information about Orange County in terms of income. Again, the red or the dark orange areas are areas of poverty and low income. And these are areas such as Santa Ana, Stanton, and unincorporated areas such as Midway City. Next, please. In terms of further what we talked about, homelessness, the major issue I wanted to bring up is that homelessness can expose children to family instability, certainly drug use, domestic violence, victimization. So there is so much in terms of trauma that's associated with homelessness and the need to get children out of this situation. Next, please. And this is just another slide related to Orange County. Thank you to Brunel for these slides. Again, in terms of home ownership, the least percentage are among our Hispanics, Latinos. So this is important for us to recognize in terms of Orange County. Next, please. I'd be remiss if I didn't mention the importance of mental health. And as you can see, in general, nationwide, 1 out of 4 children teens and adults have a mental health issue. Apparently, only 1 in 4 actually get healthcare treatment. So I think my slides are going backwards. If we can just go to the next slide on impact of children. So let me see if I can shift. Go ahead, we'll have to keep moving. There we go. Okay. Okay, thank you. So in this slide, again, this is Orange County, specific to 1 in 5 children have a diagnosable mental health disorder. Suicide is high. These are major concerns for us to really pay attention to improving mental health of children and parents. COVID, as you can imagine, has really has been a very challenging situation for children. As you can see, children who normally got food at school have, had poor nutrition issues. There have been gaps in childcare. Parents have had challenging times trying to work and take care of children. So there have been a number of issues: isolation, increased violence, etc. So these are all areas that we absolutely need to be mindful of children. And in terms of insecure housing, that is on the rise, a very significant, important issue for United Way. Food security is also very high, 20%, as you can see. And this impacts our children. Absenteeism has increased, job losses because of COVID. So there are a lot of areas, and healthcare providers can play a major role, including our school nurses. I want to mention a little bit about Nadine Burke-Harris, who's the California Surgeon General, and the significant work that she has, and some of the slides that I'll share come from Dr. Burke-Harris. So what I'd like to go into now results in just a little more about the issues of homelessness and loneliness and mental health issues. There's so much about trauma that we need to talk about. And you can see on this slide, trauma is basically defined as an experience that an individual has where they feel physically or emotionally harmed or threatened. And this impacts everything in terms of their current life situation as well as their future health outcome. In this slide, it affects all families. COVID has affected many families. So in terms of parents, domestic violence is up, maternal depression, substance use. These ACEs that we'll talk about have all increased. Excuse me. In terms of family basic needs, as you can see, unstable housing, unsafe childcare, aging parents, so many issues that families experience, as well as what's happening to the children. Absences, suspension, development delays, these are all areas that are impacted by ACEs. And when we talk about ACEs, these are the examples, as you can see. It could be abuse, physical, emotional, sexual, neglect, and also things happening in the household. Children whose parents are incarcerated, whose family members are using substances, separation, divorce, domestic violence. All of these things result in trauma to children as they're growing up. And what this slide shows is that we're all experiencing stress all the time. Stress is a good thing in many ways because it keeps us alert, elevates our hormonal levels, etc. And we could tolerate it for very long periods of time. But when you see on the extreme right, it's the toxic stress that's the real issue. where the stress is prolonged, repeated, there's no attention to it. And it often, for young children, disrupts the brain architecture and results in long-term health outcomes. And I've already given examples of abuse, neglect, substance use, etc. So these are some issues that particularly affect children. Impaired memory, low verbal skills as children are growing up if they've been experiencing these adverse childhood events from a very young age. Hyperactivity, as you can see, lower test scores. And what is really very interesting to me is that there is a literature that shows that if children by the third grade are not reading, then it has a lower likelihood that they will actually graduate from high school. And there's also a correlation between reading level and future delinquency, violence, being incarcerated. So ensuring what United Way does such a great job with, ensuring education of children, ensuring housing, those are all critical areas where we could stop the harm that's being caused by these adverse events. And this is a slide that shares some of the behaviors that are more likely to result from the experience of having ACEs. So lack of physical activity, smoking, all types of behaviors that are detrimental to health. But also you could see it can also result in greater incidence of these mental and physical health issues. Severe obesity, diabetes, mental health issues, suicide, STDs, accidents, stroke, all of these things are really important to highlight as outcomes that we all need to be aware of. And these risks, if I can give you some data, if children have an ACE of 4 or higher in terms of the number of experiences that they've had, for example, a parent incarcerated, exposure to viewing their domestic violence situation, mental illness in the family, those are all ACEs that Nadine Burke-Harris has really promoted in terms of assessment. And children who have an ACE of 4 or more, for example, can be at 3 times greater risk for heart disease, lung cancer, and stroke, and 4 times more likely to suffer depression. So those are just some simple examples. And here are another startling example, as you can see. Hepatitis is a 240% increase, STDs, as we saw, depression, suicidality. This can result in an annual cost to society of over $112 billion. So this is significant. So what can we do? There are such critical ways that we could buffer toxic stress that children have been exposed to. One of the most important things is supportive relationships. We can really come in there, provide housing as United Way does, support for education, computers, having people around them to nurture them and give them positive relationships. That's all so important. Balanced nutrition, providing integrative health practices, mindfulness and meditation are always really important to improve the stress response. Quality sleep is something that we definitely need to mention as well. So key issues, both school nurses and the healthcare community really need to get behind is to intervene early, to deal with the systemic issues that they're facing. Helping to screen, as I mentioned, for these ACEs, screen for poverty, screen for all these adversities that they may have experienced. We as researchers are advancing the science of toxic stress, and a lot of studies are being done in terms of recognizing it, in terms of implementing care within healthcare settings, clinics, because once we can recognize that children have suffered or have experienced ACEs, then there needs to be plans put in place of how we could move forward to provide the care that these children need. These are my last two slides. So I basically talked about really school health is probably one of the areas that we can really pay attention to. And in speaking with school nurses a couple of weeks ago, this was something that was on the top of their mind. How can they get involved in dealing with children with ACEs in terms of the critical development stages and healing, you know, providing healing to the children as they're going through this challenging time. And most importantly, we need to change public policy. We need to support the strategies in the healthcare system that can recognize, assess, and move forward with policy to protect these children. There's a lot that we could do in the public arena, as I mentioned, in schools. And I'm going to say, as a researcher, there is so much that we could do as researchers as well, because we need to continue to advance the science in this area. Thank you so much.
Thank you, Addie. This was very informative. Hi, everybody. I'm Alan Stapp. I serve as president of Bank of America here in Orange County. Addie, the presentation was amazing. I actually took some notes, and before we get started on the panel, this is very educational. I like the aspect you said, what can we do now? Part of it was education. You helped educate us today. This idea that 20% of the social determinants of health are related to access to and quality of healthcare, but also we have 80% is the physical environment, social factors, and health behaviors. So to me, that means we can do something about it. We can really make an impact, and we can attack it, if you will. And I was really taken by, if you think about what's happening in Orange County and impact to our children around income, housing, and homelessness, and the mental health part, and not having access to treatment, 75% not having access to treatment, that's amazing. It's something that we can work on. And the impact of ACEs, I'm glad to know that term, that acronym, because it gives us a chance to rally around something, and we can maybe impact these things around like toxic stress. And I really learned a lot about how that's correlated to the outcomes in adulthood and the impact to society. So thank you for the presentation. It was really excellent. So joining Addie and I in the panel today, we've got a great panel. So I'm going to start with introductions, and we've got with us Jason Laksamana, who is the Director of Programs and Partnerships at St. Joseph Health and Providence Health, and chairperson of Orange County Grantmakers. I also have Richard Sanchez, who is CEO of Cal Optima. And we have Brenielle Tumor Bias, who is Executive Director of United for Financial Security with Orange County United Way. So let's get started. Jason, what struck you most about Addie's presentation today?
Yeah, thank you. And thank you for having me, Alan and Addie. That was a great informative presentation. You know, what we're really talking about here is equity, aren't we? And inequity. And social determinants of health are just a way to measure and a way to indicate the different forms of inequity that we have here. What really struck me was that this idea that access to care, and to a larger extent, a care and service strategy alone, is not the answer. We're talking about social determinants, and the way to address them is not social services or supportive services alone. You know, the point that was made about behavior, that 30% is behavior and health behavior, I think is also something to look at. There's only so much that an individual can control themselves. And even though that chart pegs it at 30%, the environments and the opportunities that an individual or a family resides in may either provide the opportunities, like Addie said, or for wellness, or that place might place barriers to wellness and thus cause trauma. Things like healthy food, things like the housing situation. Is there a park? Or is that park safe? Or is there community violence there? So I think that there's a lot that we need to look at. It's not simply services, it's not simply behaviors, but that's where we step in. That's where we can come in and develop a systems and really a systems approach and look at root causes, because that's ultimately what this is about. So again, I think this is a great starting point or a continuing point in the conversation and bringing us all together to create those solutions.
Thanks, Jason. That strikes a chord. You think about what you said about safe environment, and it's not just services or public sector challenge. It's all of us. And that's part of why we're here today, is to get smarter on this, understand it, and then we've got to own it and we've got to work on it together. So that's terrific. Thank you, Jason. Richard, so how do the social determinants of health impact the population that you serve?
So just to give it context, the population that CalOptima serves is the Medi-Cal population. And that's our low-income population in Orange County, meeting certain federal policy levels of income. Currently, we have about 825,000 members in Orange County, which may seem shocking to people because they don't view Orange County that way, that we would have such a large population needing this help on Medi-Cal services. So last year, we conducted a members' health assessment needs. And what we found in terms of looking at social determinants, the highest percentage of concerns for our members was lack of money at 43%. That's very high, not shocking, not surprising, but 43% mentioned money as their number one issue. Number two was food insecurity at 32%. So we definitely have issues related to access to healthy foods and food in general. Number three was transportation, lack of transportation at 28%, and finally housing at 24%. And what I would say in terms of housing being last, what's your first concern? Your first concern is getting money to live and food to eat. That probably is why housing is down further on the list, but housing definitely is one of the major factors for our members. So I'm happy to say that the state of California, if you don't know, our money comes from the federal government through CMS, Centers for Medicaid and Medicare, flows through the state and then to the local health plans, which in Orange County is CalOptima. Currently, the state is undertaking an effort called CalAIM, stands for Advancing and Innovating Medi-Cal, and we're looking at social determinants. So we're starting, as Jason said, normalizing this concept that look at the person as a whole, not just their health, because all of these other factors impact their health. In addition, I would say one of the algorithms we need to look at is what are those upstream services, those intervention services we can take before they do the most expensive thing, which is go inpatient into a hospital. And so there is return on investment on looking at these factors. So exciting times. CalAIM is moving forward. We've integrated mental health into the physical health aspect of the members, and now we're integrating social determinants. So it's exciting times.
Thank you, Richard. I'm shocked. The 825,000 of our fellow members here in the community are in your population. That's a big number. I don't think our audience maybe knew that. I didn't know that's astonishing, and I thought it was interesting. I wouldn't have known about the order in which those priorities about money, food insecurity, transportation, and housing. But again, this is a chance for us to learn, and I really like that takeaway of look at the person as a whole. That's really great, and I'm going to make sure that I get better at that. Brenda, let's move over to you about so based on what we know, we've learned a little bit here from Addie and others. where should our efforts be targeted to support families who are the most vulnerable?
Yeah, I would definitely say with what we know, I feel efforts should be targeted to support families in Orange County who are most vulnerable with a multifaceted approach. Of course, several strategies working together. I think there certainly has to be more implementation and scaling up of best practice solutions, like the community schools model, where schools become a hub in the community, offering an array of services to support students and their families. And those services are not only accessible, but they're of high quality. I also think interventions have to be designed thoughtfully and holistically, as we've been discussing. We have to do so and do away with the one size fits all approach, as we've talked about as well. And if you're not considering the interconnectedness that we've been discussing today, through the lens of the social determinants of health, you will create what we've all seen and experienced in the community, this whack-a-mole situation where you're addressing one issue and another issue is popping up and you miss the mark. So I definitely think there has to be a willingness to be flexible and certainly pivot. That was our theme word over the last year, and doing whatever you can to remove obstacles at all costs for these families. Also, as we're seeing, there has to be a concerted and coordinated effort. Really when it comes to data, I would say using data that's informing your storytelling and your decision-making. So out in the community that we're putting out accurate information within the community that's building the right type of public awareness and creating the narrative, but also then building solutions that best serve families and give them the opportunity to thrive. Certainly want to reiterate what's been said already. At every level, we absolutely have to use a race and equity lens, moving beyond the rhetoric of, building actionable steps from whether that be our DEI statements or other policies and procedures. This is our opportunity, and time is of the essence to really challenge and dismantle systems that perpetuate racism and threaten equitable services and outcomes for families. So a lot of work to be done. Obviously, public policy has to be at play, a focus to increase public assistance, remove benefit cliffs, and promote equity, as we've said, across housing, education, and healthcare. And really start to not consider just short-term solutions, but solutions that allow families to stabilize over time. So a lot of opportunity. I'll close with kind of also the space of philanthropy and the role of grant makers. There certainly should be a greater shift of investments in parts of our community where we know there are high percentages of families who are experiencing instability, whether it's housing or financial instability, have lack to access and quality healthcare or education. And really start to see more braided funding streams, the private and public sector working together to really close gaps. As Richard says, there has to be this uptick in our focus on prevention. And really, as was called out by Addie's presentation, this opportunity to factor in stressors and trauma that is affecting families in our work as well.
Thanks, Brenielle. So I'm a big note taker. Okay, so you're giving me more, you have more notes for me. So thank you. I'm gonna go back and connect the dots. Addie informed us earlier about the 20% and 80%, which really means that we can attack this together as a community. And the interesting comments you made about a multifaceted approach and access to services, but also those services need to be quality services. And I do like the idea that one size doesn't fit all. As us, we've got to customize our approach, avoid the whack-a-mole. We've got to be flexible and pivot. By the way, we could use that in everyday life, not just for this opportunity here. And being the banker, I'll tell you, I like the idea of using data, right, and have accurate data to develop the solutions, and most importantly, have those solutions be sustainable. So I think those are really, really good points. Addie, let's go back to you. And so I'm all fired up. I'm sure the panel's fired up and the audience is fired up about attacking these things. But what challenges do we have out there? Or what could hamper our ability to address the opportunities?
I think that the very first thing that I said, if you hear nothing else, this is critical. It's that disempowering individuals. We as healthcare providers, as nurse practitioners, as physicians, we are always doing everything we can to get people to understand that the behaviors that they might be engaged in are not going to be helpful to improving their health care. But the bottom line is if they feel disempowered, they're never going to make those changes. So it all does get back to inequities. We need to do everything we can to deal with that issue first. Well, I shouldn't say first, while we get housing and while we improve relationships and how we assess and access to care is part of the picture. We need to do that. But it's time that we make it, and I know there's a lot of clinics that are now beginning to put into place assessments for social determinants of health. That's all important. I bring up the school nurses again because they see these children every day. They practically live with them. They are such critical members of the team. So all of us together as a group need to work together, but we need to figure out how we can improve the inequity issue so we can empower people to want to improve their health, which will go a very long way. So that's just one important issue I wanted to raise again.
Thank you, Addie. It's interesting. So you see the term disempowering. Okay, I think most of us are used to hearing empowering, but the idea of disempowering, because that really is sort of a root issue. And you've got these issues of inequity and wrapped around the idea of access to quality healthcare, which really, really is a barrier. And it's interesting about the school nurses. Let me ask you something real quick as a follow-up. School nurses sort of on the front line, great source of information. Do we have a consistent way to gather the information from those experts, those really on the ground with facing these challenges and seeing it? Do we have a way to capture that data and help to rally them?
That's such a great question, Alan. In the meeting that I had with school nurses just a couple of weeks ago, what I discovered was that they don't have a systematic way of actually gathering that data. So we have actually a faculty member at the UCI Sue and Bill Grove School of Nursing whose area is school nursing. And her area of research is to put in place processes that because she's got a background in informatics and school health, she's really interested in moving that science forward in terms of gathering the data that you're talking about, which is so important, and bringing that information to healthcare providers, CalOptima, everyone who's got a role to play in improving the situation. But it's gonna, many of the children, as I mentioned before, who are in school actually are homeless. So getting housing, food insecurity issues dealt with, helping parents to, get employment, all of those things are just part of the holistic picture.
Thank you, Addie. We're actually a little ahead of schedule, which is good.
Jason had a question, I believe.
Oh,
Well, I just wanted,
Jason.
if possible,
Yeah, go ahead.
if I could just jump in and build off of what
Please.
Addie said. I think when we look at this, building off my fellow panelists, for a long time, this discussion has been about disparities. And going off of what Brynjel talked about, this is really about equity. And this is really about empowerment, what Addie said. And so for us to craft solutions, it has to be an institutional framework shift. We need to get out of a strategy that focuses primarily on services and treatment, and instead look at capacity building and a prevention strategy that focuses on the systems, the environment, the resources in the community. So, and Richard talked about this, it means going upstream. And it's not just upstream in interventions and services, but looking at what's at play in the community. And so, ACEs, and I'm a believer in ACEs and have a lot of respect for it. It's absolutely important and critical. There's, as we heard, hundreds of thousands of people living in Orange County, dealing with trauma, living and dealing with it. And ACEs and trauma-informed care based on screening and early intervention will be life transforming for many people. And it's absolutely critical, but it's not enough. Trauma-informed care by itself will not prevent trauma from happening. We need to deal with the reason that people experience trauma in the first place. And this is bridging off of Breniel's answer. We need to deal with the root causes, inequity, poverty, violence, unequal opportunity, racism. And we need to stop these factors that create this steady flow in need and inequity, basically stopping the ACEs from forming themselves. And so doing that, only doing that will prevent trauma. So in many foundations, in many in philanthropy, a lot of us are working on a companion to ACEs called ACER, which is Adverse Community Experiences and Resilience. It's a companion approach that's not just about treatment, but a recognition that we need to prevent the trauma in the community, prevent the causes of ACEs, and transform the shared community experience into resilience in the face of these negative stressors. So it's going to take an all hands on deck approach. It's going to take all of us working together, service providers as well as advocates. But I think that's where we're trending towards in the community.
Thank you, Jason. That's awesome. Actually, why don't we use that as a pivot point back to Richard. Jason talked about trauma and dealing with the root causes and inequity, and it is all hands on deck. But Richard, from your viewpoint and your experience with your customers and the population you serve, how do you think, or tell me what your impact or your view is on the trauma and the root causes and equity, and maybe how we can move forward?
I think Jason hit some really important topics and was right on point. And maybe I'll use that as a jumping off point of, you have many people on the panel related to healthcare. And when we say all hands on deck, I think we need to include people that we wouldn't normally think of: our criminal justice system, our jail population, our law enforcement. And I know that can be overwhelming when we start going in that direction, but I will say this in terms of the jail population. Many of those people are my members once they hit the street. And so we need to start talking about things like re-entry, if you're familiar with that term. When an inmate is released, what do? They are typically dropped on the street with nothing. If they were on meds, their meds stopped. If they were under treatment, that stops. We need to start looking at as I mentioned earlier, the holistic approach to looking at populations. And that's just one population. I think another population mentioned was homeless, a really huge issue here in Orange County. And what gets lost when we talk about homeless is the housing insecure. How many people are couch surfing? How many people are in a single family unit with 2 bedrooms with 3 families living there? This all goes to the trauma that child may experience by not having a place to do their homework, or even a place to be alone for a moment and be able to have that sort of one-on-one relationship with a parent. Again, I say these things because we don't have a lot of time, because I know when you throw this out there, it can seem like, whoa, this is too much for me to discuss or even try to wrap my hands around. I will say that has started. You know, I've been in healthcare all my career here in Orange County. I know Don Barnes, the sheriff, because I tell him, you have so many mental health patients in your jail. You're the biggest mental health provider in the county. Those are going to end up being my patients. So let's talk. I've talked to the district attorney's office, same thing, public defender's office. People you normally wouldn't think of that need to be involved in this conversation. I think that has started. I know it has, because you're seeing it not just in Orange County, but in other areas as well. So that's all good news. So we're beginning to look at this thing more holistically.
Thank you, Richard. You know, it's interesting, and I'm going to ask Breniel to pivot off of some of the concepts that you just brought up. I'm thinking outside the box. interesting to think, obviously, holistic approach, including the reentry of incarcerated population, working with the police, the housing insecurity. And yes, you're right. It feels like a lot, especially when you try to consume all the information, education that we're trying to present today. But we got to get started right somewhere. And what are the things we can do? And I know United Way. So Breniel, maybe you could talk about a few things that United Way is doing and some of the your viewpoint on Richard and Jason's comments.
Yeah, certainly happy to do so. I would say at United Way, the social determinants of health have really been our approach to be a driver for change in the community. One that we're constantly seeking to grow in this space and evolve. So we're best meeting the needs of the families who need our assistance. For us, it's really been a key anchor for our work in reminding and encouraging the team to always strive and look at the situation from all angles, as we've been discussing, to really be probing all of the factors, as Jason described. There's so much going on at play when we're seeking to provide solutions. So, we can't just double down on economic stability. We also have to focus on access and quality of education and healthcare. And for us, it's really kind of our lens at a macro level and a micro level. It's how we do our strategic planning, how we've launched initiatives, how we're doing our grant making, engaging intentionally with stakeholders, and designing programs and working one-on-one with individuals. For us, it's really about working diligently and holistically in terms of being a funder, an advocate, convener, and an educator. And all of those things we're doing in conjunction with one another to help families go from surviving to thriving. Certainly over the last year, for so many organizations, this became critical and paramount in our work. I would say it's raised our level of commitment even higher to serving families. We've really seen families in crisis, obviously, over the last year, and knowing that presenting issues weren't isolated. I really appreciate Jason's comments about, not just being focused on services and capacity building and thinking, and Richard, who else needs to be at the table? How can we think outside of the box? That really has to be the ongoing approach, to break down silos, to be collaborative, to do things as we've never done before, to not forsake, good for great, to try new things, to not be in this space of, well, Orange County is not as bad as other places, as kind of a justification for doing very minimal or doing nothing at all. So I really think there's hope in kind of the solutions that we're talking about today, and always just want to be mindful that in the families that we're talking about and serving, what gives me hope is always that there's so many solutions that can really help families to thrive. There's incredible resilience we've all seen around the table with these families, their perseverance, their motivation. And so creating the right levels and foundations and systems that help them to do so is really the opportunity we have before us, and which is really exciting, and provides me hope and hope for other families.
Thanks, Breniel. You're right. We got to try new things, and doing nothing is not an option. So what today's about, and our panel and our presentation back in January are moving this forward, and let's go and attack this. We've got some questions from our audience, and Addie, I'm going to start with you. One of the questions we received was, how do we break down the silos between education, healthcare, and housing to address these systemic issues?
That's such a great question. I think first that these entities, the school individuals, healthcare individuals, and organizations like United Way, who are doing such a great job in terms of housing homeless families. I think that getting them together to decide prioritization, what would be, getting housing seems to be the most logical thing first. Once you get them stable, then ensure that healthcare is being provided, assessing what their needs are, assessing the children in terms of what their scores might be, and providing all the supports that we talked about could be one example of how you bring those three together and drop the silos. I think that might be just one example. It's bringing people together at the table who have these different domains of of work and trying to come up with solutions that override across all three. That's the only way we can, by breaking the silos, that's the only way we could enhance the health of these populations.
Thanks, Addie. We have another, that's so important. We've got to work together, right? So Richard, I'm going to ask you another question that came from the audience. The question is, how are organizations working to reduce recidivism of students, disproportionately students of color involved in the juvenile system?
Again, I would say it's talking to other agencies that have impact on these populations. Social services agency is primary that comes to mind with all the programs they have related to youth, especially foster youth. And I don't know, I tend to try and slice and dice a little bit to make it more manageable in the approach. And I don't know if people are aware, but foster youth are at significant risk and have a lot of issues once they age out, as they call it. And then they're left without any of those services. So it's looking at the needs. I think it was Brenielle who said, one size does not fit all. That's kind of the approach I try to take with these populations. And with youth, foster youth in particular, is something that's under the CalAIM initiative, and looking at that population and how we could do a better job. Many of them end up homeless. That's way more expensive than trying to do those upstream services that I talked about earlier to prevent that. So another thing I'll throw out there in terms of youth, and all of you may be familiar with this, is CHOC has the only inpatient unit for mental health for youth, for those under 21. Unfortunately, the unit is full all the time. So what does that tell you about what's going on with youth in Orange County? When we have an inpatient unit for mental health that is always full to capacity. And that's the only one there was, by the way, and there wasn't even one of those before that. So CHOC stepped up and created that. And so we definitely have work to do. I think Addie mentioned the mental health impact of COVID. I think we need to get in front of that now. That discussion is just beginning to happen, but the impact that that's going to have on youth in particular, I think is something we need to start talking about now, because I think we're going to see the consequences soon rather than later.
I could jump in real quick. I think
Sure.
just piggyback on what Richard said, it's also looking at the different policies in place. I think, the school, the prison pipeline, suspensions, detentions that disproportionately affect our Black and Brown and students of color in the schools. That's a real thing. And so we have a lot of schools and school districts who are working on adjusting their policies to be less punitive and more therapeutic. I'm thinking about Anaheim Union doing that, Anaheim Union School District. So it's looking at adjusting the policies in place to be more responsive to youth, to heal, like Addie mentioned in her presentation. So I think that's one of the ways to prevent recidivism in these populations. It's also working with a lot of these great nonprofits. Project Kinship, which is one that works primarily with this population, and healing in community, getting to that upstream. Again, not just a service approach, but a community approach.
That's terrific. I like the community approach, right? We're all in this together. So we're at the end of our segment here for the panel. I want to thank the panelists, Addie and Jason, Richard, and Brenielle. Great job today, and thank you so much. And for everybody in the audience, I think the opportunity from today is it's continuing to build on the awareness and education. And the takeaway is share what you learn, continue to learn more about the opportunities that we have here in Orange County, and let's start taking action. Yes, it's a big challenge. Yes, there's a lot to work on, but we can do it, and we can start with small pieces, but they can make a sustainable impact. Okay, with that, I'm going to turn it back to Sue. Sue, you got the program.
All right, thank you so much, Alan. And wow, thank you, Addie, for your address at the beginning. We're hoping we can share the slides. We're gonna have a few questions asked about that. We'll follow up and let everyone know. And to our panel, Alan, thank you so much for your leadership of overall United for Financial Security and this really integrated initiative that we really want to help lift the county. And so thank you for your leadership and for moderating today's amazing panel. So for Richard and Jason, and of course, our amazing Brynell, thank you too for everything that you do and for really highlighting the needs here in the community. We do believe in this community approach and I hope everyone out there knows that, and we want you to be involved. And if I think about what Alan said, this is part of our journey, educating more folks and hopefully bringing everybody up. I love some of the conversations today that this really is an equity issue, like just trying to manage and hoping everything is going to get solved isn't going to work. We need to work together to create different models where people have the opportunity to create wealth, to get ahead and to thrive and prosper. And we need to do that as a community together. And there's different models out there. We can take best practices, but we can also do some incredible things together here in Orange County. Because if any community can do it, working together, we can. So I'm very energized by that. So the community approach focused on with this equity lens in terms of not just helping people get by, but helping them thrive. How do we do that together? That's more to come in terms of we're doing it. And I think just this overall topic is so important. And I'm so excited, Richard, that the state and you locally are embracing this. I mean, it's just so incredible to have conversations about the importance of getting ahead with housing and food and all these other topics at the table versus just medication and how do we handle things in just a medical way in a silo. Everything works together, and that's what's powerful about being united. So thank you all for that. So again, more to come. Please share the word. Tell everyone you know about United for Financial Security. There's going to be opportunities for you to share information, to advocate. We talked about school nurses, for example. I can't wait to connect to Addie's individual and learn more, because I don't think there's a school nurse in every school. I don't think there is anymore, like maybe, and that maybe is something that powerful we can do together, this idea of creating more hubs in our schools. We have a few in Orange County and we'd like to create more. So there's opportunities for everybody. So thank you all, and I appreciate it. Everyone have a great day and more to come. Thank you.